So there's lots of arguments all over the internet about what is the best treatment method out there. I see it everywhere. People arguing left and right about what is the best. So I've had exposure to a lot of things. I've been going on, this will be my 16th year of diving into all this since I started grad school. And, I've taken everything, every course you can imagine, every certification, and some good, some bad, but it's really hard to determine exactly like what the best treatment is. So I talked about this in a prior video. And if you're watching on YouTube, I'll link it up top. But I talked about the order of operations to fixing a problem. If you're watching this anywhere else, I'll put it down in the description box below. But I talked about there's 4 steps to fixing the problem. First, we have to restore range of motion. Then we have to balance strength. Then we have to increase strength. And then if we need to reprogram the neuromuscular system, we do it. Most of the time, you don't need to do that because a lot of the problems are coming from dysfunction in the tissue that we fixed already. So anytime I teach a seminar or a course in my method, the peak method, I always start every single course in class with a demonstration with a rubber band. And I explain this. I do this to my patients as well. I go, okay, so the goal of our treatment is we need to start by restoring range of motion. So range of motion gets limited. That's when an injury happens. So essentially what happens is over time, scar tissue builds up in either the fascia, in the ligaments, in the muscles, and then eventually it gets stuck to the nerve and creates a nerve entrapment as well. When that scar tissue forms, it causes that area to be less flexible and weaker, and it also creates a lot of pain. So our job as a manual therapist is breaking down that scar tissue. So I think of the scar tissue as like this rubber band. Now, here's the thing with the rubber band. Say I need to break it, and I want to break it down. I could put it on the floor. I could jump on it. I could stomp on it. That's not going to break it. I could drive over a car with it. That's still not going to break it. What breaks it is tension, getting proper tension on that area and breaking that down. And that's what we do as manual therapists. So the proper concepts of effective manual-based soft tissue treatments, at the end of the day, first you have to be able to identify where the dysfunction is, where the range of motion is getting held up. We do that with a functional-based type of testing, a thorough history, and everything like that. But in order to break down that area, what we have to do first is get proper depth into the tissue. And it depends on where the area is. There's some areas where we don't get as much depth, other areas we have to get more depth. Then what we do is we back out slightly. And we back out slightly, that takes some of that ease off of that tissue. Then what we do is we set some tension right into it. So say this is where the scar tissue is. I want to be just below that, about a thumb width down. I get my depth into it and then I tension into it as well. That loads it up. Then I have the client go through a full range of motion. As I'm doing that, that's ramping up tension more and more, and it's eventually going to break that over a series of passes as I get through there. Now, deep tissue massage, a lot of people are like, I do deep tissue massage. Yeah, sure, that's fine. And it might temporarily help them feel better and stimulate some tissue, but you're not breaking this down. This is the same thing I talked about. You're just getting in there and you're jumping on the rubber band, you're driving it over with the car. And you can use your elbow, you can use whatever you want, you can put all the pressure you want in the world. All you're doing is squeezing that tissue. And that squeeze is only one of the components. You need the squeeze and then you need the tension as well. So if you're doing that and you're not having them go through active range of motion as they're doing that, you're not effectively breaking that down. Now, stretching. A lot of people like to do stretching. The problem with stretching is it does stretch that tissue out a little bit, but it doesn't have that tension component in there as a breakdown. So temporarily, when you do the stretch, it does feel a little bit better. They have some improved range of motion, but you didn't actually make a change in the tissue. You didn't actually break down that scar tissue because you didn't get depth and tension on it. You get just tension, but no depth, it's not going to break it down either. Now, cupping, I know a lot of you like to use cupping, and I'm not anti-cupping. I just don't think it's an actual treatment because it's not going in there and restoring range of motion. Sure, it can be used in between treatments to help with some inflammation and some breakdown of that. But once again, you're not getting tension on there. Now, I've seen some people on the internet out there, they put a million cups on people and have them go through all these ranges of motion. Yeah, you might think that you're doing something in there, but you're missing those components. You're getting some depth and a little bit of tension, but it's not optimal. You're not going to get that with the cups. You need to do it with your hands. And then lastly is just corrective exercises. Those are fine once the tissue's healthy. So many people want to just do an exercise right away. I always say trying to introduce an exercise before the tissue's healthy is like trying to fix a cavity by brushing and flossing. It's not going to fix it. It needs a hands-on manual approach to go in there and break it down. So a lot of people out there, they like to do myofascial release, and I think myofascial release has some really good qualities to it because it is getting the concepts of depth and tension and actually moving the client through a full range of motion, which produces tension. The problem what I see with most myofascial releases, it's actually way too compressive. When they go into the area, they press down too much on that, and then the tissue gets trapped and it can't slide how it's supposed to. So in turn, it hurts like hell when you're doing it for the clients. They temporarily feel better because you're stimulating some mechanoreceptors and blocking some pain, but it's actually not making a long-lasting effect. I always say there's 3 components to the treatment. It has to be safe, effective, and durable. Yeah, myofascial release is safe. Effective, yeah, it temporarily does feel better, but durable. If we break down that tissue and we break down that scar tissue, we should see an improvement in that functional test, and we should be able to have them go a week in between treatment, and they come back and that range is still holding. So think about this anytime you're about to do a treatment and understand, is this a treatment or not? Am I getting depth and then tension to break that down? So that's all I got for you guys in the video. You can share any thoughts or insights in the comment section below. I'm always open to have a spirited discussion and debates to help everyone else grow. Appreciate you guys watching this, and I'll see you on the next one. Bye.